Welcome to The Political Mechanic. My name is Stephen Thane. I promised to discuss solutions to our healthcare system, but before we get to concrete reform, we have to begin with first principles. Healthcare costs in Idaho are rising faster than economic growth. They're squeezing all other budgets, including family budgets. If we don't address the foundation, no reform will hold. So let's begin by confronting a widely accepted belief, the idea that healthcare is a right. Many sincere people argue that it is. They say healthcare is essential to life and dignity. In a wealthy society, they argue, access to healthcare should not depend on income. From that perspective, government must guarantee it. That sounds compassionate, but it rests on a different definition of rights than the one embedded in our constitutional republic. In the American tradition, rights protect individuals from government overreach. People have rights, speech, life, religion, and government exists to protect those rights. The right to worship does not require taxpayers to build a church. The right to speak does not require your neighbor to buy you a microphone. A right limits government power. It does not expand it. When we declare health care a right, we convert it into a claim on other people's income and labor. Government must take from some to provide for others. This is not the protection of rights. It is redistribution backed by force. It is an inversion of what rights mean. And this corruption, if left unchecked, must destroy any nation that embraces it. But even if someone insists that healthcare is a right, another question follows: is it unlimited? Can a system remain just if individuals are free to smoke, overeat, avoid exercise, and then compel everyone else through law to fund their poor choices with unlimited access to healthcare? That makes no sense. But that's what we have. A society cannot detach behavior from responsibility and expect sustainability. When personal choices carry no financial consequences, incentives break down. Costs rise, burdens shift. Families who are working hard to provide for themselves are required to subsidize decisions they did not make. This is not compassion. Compassion helps people improve their lives. A rights-based healthcare system, on the other hand, without accountability undermines both justice and health. In a constitutional republic, the needs of the poor have traditionally been addressed in two ways. First, by helping individuals supply their own needs, and second, through private charity. This preserves the free market character of the nation and prevents unlimited government growth. Even nations that call healthcare a right reveal a sleight of hand. They limit spending through rationing, waiting lists, and delayed care. In practice, they do not treat it as unlimited either. They restrict access by rationing. So we cannot fix our healthcare system by granting government unlimited authority to extract wealth in the name of rights. If we see healthcare clearly as a valuable service rather than an entitlement, we can design a system that is compassionate, sustainable, and consistent with constitutional principles. And that is where real reform begins.